Good morning, everybody. I'd like to call this meeting of the House Health Committee to order. Devin, will you please take the roll? Here.
Representative Benham. Here. Representative Borowski. Boyd. Here. Hanbidge.
Designation.
Howard.
Designation.
Khan.
Designation.
Kozarowski.
Designation.
Krajewski.
Designation.
Mays.
Designation.
Frillotten.
Designation.
Sanchez.
Designation.
Schusterman.
Designation.
Venkat.
Here.
Chair Rapp.
Here.
Representative Bonner. Horowitz.
Yeah, here.
Brown.
Designation.
Day.
Designation.
Krupa.
Here.
Roy.
Here.
Rossi.
Here.
Stair.
Here.
Twardzik.
Designation.
Walsh.
Here.
Zimmerman.
Here.
We have quorum.
Thank you. We have a quorum. The chair calls up House Bill 1652, printer's number 2005, sponsored by Representative Salisbury, which adds Gaucher disease to the list of mandatory newborn screenings. Representative Salisbury is in the audience. Would you like to offer some remarks?
Thank you. This disease, Gaucher disease, is a deficiency of an enzyme that processes lipids in the human body. And it's something that we actually used to test for in Pennsylvania and is no longer on the newborn screening panel. It is tested for in many other states. The condition is most prevalent in Ashkenazi Jews. Up to 5% in certain pockets of populations of Ashkenazi Jews can have Gaucher's disease. But it does occur in other populations, and as we've seen with the rising popularity of at-home consumer genetic testing, you may never know what's in your genetic background, so it may occur in a variety of different folks, even if they have no known Ashkenazi Jewish background. So essentially, what I would like to do is correct an issue that I find bizarre, which is if you go and have a child in New Jersey, your child will be tested for Gaucher's at birth automatically. If that child is diagnosed with Gaucher's, they will be sent to Pennsylvania for treatment because we have some of the nation's foremost experts in this condition. But if your child is born in Pennsylvania, your child will not be tested for it at all. And you may spend years trying to figure out why your child is struggling, why they're not progressing as you would like. And I think we can all imagine what that would be like for a family to wonder why their child is sick and not be able to figure that out. But this is a simple test that all children can be pricked on their heel of their foot, and that blood can be put through a machine that is already programmed to provide that Gaucher's diagnosis. It is simply a matter of Pennsylvania deciding to unblind those results that come through that machine testing process. So I would ask everyone to please support this so that we can return Gaucher's to be tested for in Pennsylvania and not allow neighboring states to surpass us in newborn screening technologies. Thank you.
Thank you, Representative Salisbury. The question is, will the committee report House Bill 1652? Is there any further discussion on the bill? Representative Venkat.
So, thank you, Chair Frankel. I want to thank Representative Salisbury for bringing this legislation forward. I do plan on supporting the legislation. My one concern is that we've obviously had discussions about the technical screening panel, and my sincere hope is that the panel will look at an expedited application related to Gaucher disease in order to review the evidence on newborn screening at this point. And I think a vote for this legislation can be an urgency to them to take that up.
Thank you. Any further discussion? Chair Rapp.
Thank you, Mr. Chairman. Thank you, Representative Salisbury. I believe that this is an important bill. And newborn screening is an important tool to detect serious but often treatable genetic and metabolic disorders that may not be apparent in a newborn at birth. and you've obviously done your homework on this screening. But often diseases that are not identified early on can lead to health problems if left untreated, which you are aware of and why we have this bill in front of us. So the screening does allow for early diagnosis and intervention, which in turn allows for an improvement in health outcomes for newborns. And in addition to improved health outcomes, early intervention and treatment can reduce medical costs for newborns as they grow and develop. We received a lot of relevant information regarding the disease at our informational meeting last month. I don't think a lot of us were really aware of this disease, and so that was very informative. And some of the testimony did address concerns with how the application in the Gaucher disease in the newborn screening program was handled, which I would say seemed to be very poorly. As with any law that provides oversight by a board or commission, the General Assembly must determine when they should intervene and when they should defer judgment to that board or commission. Often that decision is made on a case-by-case basis. As I stated during a committee voting meeting last month, I will be taking a close look at the fiscal note that we received for this bill and all bills going forward. I can't imagine that this would be costly, but I was concerned over the fiscal note of a prior bill. And I want to know that the Department of Health projects the cost to add this disease to the newborn screening program, what it will be. And so at this time, I will be supporting moving this bill. And Mr. Chairman, I think this is a very important bill for all infants, and but especially, you know, certain people in our community that I think deserve this support very much so. And I appreciate all the work that you've done and the informative hearing, Mr. Chairman, that we had. I would encourage my members to support this bill as well.
Thank you, Chair Rapp, and thank you, Representative Salisbury, for bringing this bill to us. And again, that hearing was very helpful, I think, in terms of informing this committee about the timeliness of moving this forward at this point. Again, I would join with Representative Venkat. There would be, to expedite this through the existing channel would be quicker than probably going through this legislative process. But seeing if that doesn't happen, this is a kind of a fallback position. So with that, I would join my colleague, Chair Rapp, in asking members to support House Bill 1652. Devin, will you please let me just say this. Are there any negative votes on House Bill 1652? See none. House Bill 1652 is reported unanimously from the House Health Committee, and I thank the members. The chair calls up House Bill 1715, printer's number 2111, sponsored by Representative Flood, which adds Duchenne muscular dystrophy to the list of mandatory newborn screens. Representative Flood is here in the audience, and would you like to offer some remarks?
Good morning, everyone. Chair Frankel, Chair Rapp, and the House Health Committee members, thank you for your consideration of House Bill 1715 today. Duchenne muscular dystrophy, or DMD, is a rare yet severe genetic disorder often affecting young boys, though young girls can also be carriers. It causes progressive muscle and loss and affects multiple parts of the body, including skeletal, lung, and heart muscles. Without intervention, DMD can lead to significant disability and a shortened lifespan. Early diagnosis is crucial as it enables timely medical interventions, access to therapies, and participation in clinical trials. In fact, there are currently 8 FDA-approved treatments for DMD, most of which can be started at any age. Time is certainly of the essence when it comes to deteriorating muscles. However, DMD is not currently included on Pennsylvania's newborn screening panel, which is a missed opportunity for early detection, diagnosis, and preventative treatment. Children and adults with undiagnosed DMD often suffer through years of blood draws and other testing before arriving at an official diagnosis. And in some cases, people may go their entire lives without knowing DMD was a cause of their health complications. As a child, this can be painful and a traumatic experience. And for parents, on top of an overwhelming emotion and distress of watching your child go through something like this, the repeated doctor visits can be very costly. By adding DMD to the newborn screening panel, we can improve quality of life and long-term outcomes for children and prevent families from ever having to go through the heartache of not knowing why your child is suffering. One diagnosis can also point to other carriers within a family and ensure action is taken before it's too late. Again, I want to thank the committee for taking up this important piece of legislation and would appreciate a positive consideration.
Thank you, Representative Flood. The question is, will the committee report House Bill 1715? Is there any discussion on the bill? Chair Rapp.
Thank you, Mr. Chairman. Mr. Chairman, I just want to thank Representative Flood for bringing this before the committee. And my comments on this bill would be the same as the prior bill. But thank you, Representative Flood. And I would ask my members to support this bill. So thank you, Mr. Chair.
Thank you, Chair Rapp. And I join Chair Rapp in asking members to support House Bill 1715. Are there any other comments? If not, are there any negative votes on House Bill 1715? Seeing none, House Bill 1715 is reported unanimously from the House Health Committee. Thank you, members. The chair calls up House Bill 1043, sponsored by Representative Venkat. Erica, would you please explain the bill?
House Bill 1043 amends the Public School Code to allow for alternative mechanisms of administering epinephrine in cases of allergic reactions.
Is there any discussion on the bill? No, excuse me. The question is, will the committee report House Bill 1043? Is there any further discussion? Representative Venkat.
Thank you, Chair Frankel, for calling up House Bill 1043. As we know, allergic reactions are a severe issue in our communities, and that's why our public school code has reference to epinephrine auto-injectors in it. The issue is that we thankfully live in a time where there are now new formulations of epinephrine which are available for definitive therapy for anaphylactic reactions, including the epinephrine nasal spray and likely soon a oral film dissolving form under the tongue for oral use as well. It's important that our statutory framework is updated to reflect that, and this legislation would allow us to do so by using the term epinephrine delivery system, which would be a comprehensive term for future formulations and prevent us from needing to make further statutory fixes in the future. I want to thank Representatives Serrato, Giral, Kozarowski, Marcel, Mihalik, Schaefer, and Warner for their partnership on this legislation, and I hope that we can have an affirmative vote on this bill.
Thank you, Representative Venkat. Are there other comments or questions? Chair Rapp.
Thank you, Mr. Chairman. Thank you, Representative Venkat. Epinephrine is a life-saving drug for many individuals, and in 2024, the FDA approved epinephrine in a nasal spray form. So, as Representative Venkat said, this bill will allow schools to use nasal spray as well as other forms that may be approved by the FDA in the future. It's my understanding that this bill does not change any other existing statutory framework, limitations, or precautions related to epinephrine use in schools. So as such, I'll be supporting moving this bill out of committee today, Mr. Chairman. and ask my members to support as well. Thank you, sir.
Thank you, Chair Rapp. I join Chair Rapp in asking members for a yes vote. Those in favor of reporting House Bill 1043 will vote aye. Those opposed, no. Are there any negative votes on House Bill 1043? Seeing none, House Bill 1043 is reported unanimously from the House Health Committee as committed. With that, there's no further business in front of the House Health Committee, and this meeting is adjourned. Thank you.